everyone. Welcome to another episode of Tell Me About Your Dog. I'm Sam. If you're new here, I'm a CVT here in Florida, a pet insurance advocate, and a lover of all things senior pets. The goal of this podcast is plain and simple, telling me all about your dog and what makes him special. And I have the lovely, amazing Dr. Anna Bannon joining us again, back by popular demand. Dr. Anna, thank you so much for taking time out of your busy schedule to come and join me.
Thanks,
How
I
are
love
you?
it here. I'm doing good.
You had quite the busy week. Did you have anything crazy go on at the hospital?
Always. There's always something crazy going on.
Yeah. I had one crazy case, a possible lepto. We think
wow.
we didn't confirm because obviously testing takes a little bit, but came in feverish, very lethargic, almost had that not wobbly, but that
There's a weakness.
yeah. And was not responsive to fluids and bringing down the fever,
Aw.
and started to more and more have lepto symptoms. So
Yeah.
we did transfer it, but I was like, wow, I haven't seen a lepto case in a long time.
Because we're vaccinating for it.
Exactly, yeah. And unfortunately, this dog was not vaccinated for lepto.
Yeah.
So, but we do see it.
Yeah.
It's crazy. What about you? Anything stick out from the week that you're comfortable sharing?
Yeah. I did full mouth extractions on a cat. So a
Ooh.
cat with really bad stomatitis, not even that old, which is common.
Mhm.
It's not quite dental disease, but more of like the inflammatory reaction that the gums have to the mouth. So spent a couple hours in a cat mouth this week pulling all the little teeths.
And for people who don't know about stomatitis, what is something that gives owners a little notification like, oh, wait, something might be going on with this cat's mouth?
Yeah, so they can be painful where they'll actually like move their mouth a weird way or start dropping their food or be hesitant to eat. And then there's the smell. So if you ever notice your animal kind of comes up in your face to rub on you or meow at you, bark at you, and any of those things, and there's a really bad odor, you should get it checked out.
Yeah, tooth issues in general, the odor is very, I don't want to say distinctive, but it's almost like a pungent odor.
Yeah.
It just hits you in the
Smacks
face.
ya. Yeah.
Exactly. All right. So leptospirosis, for anyone who is not in the vet field listening, is a bacterial infection illness that is from contaminated water. So a dog that drinks water that's been contaminated by rodent or wildlife urine that is infected with lepto, it is transmitted to the dog, and it can actually be transmitted to people. It's contagious from dog to people. So
Yeah.
that's why it's taken very seriously. And I am glad that we got that dog medical attention, and the owner did everything that they needed to do. And the dog is doing well from what I heard.
Good.
Yeah.
I had a client once who had lepto.
Oh.
I was telling them about the vaccine and he's like, oh, I know about lepto. I had it and almost died. Yeah,
Wow.
he was in a coma and this is interesting. This is when he lived in New York. And so he went into multiple organ failure and went into a coma and no one knew why. And they had to bring in a disease specialist because he had traveled to South America and apparently he went swimming in a waterfall in South America. And then he went back up to New York and got really sick and it took a while, but they diagnosed him with lepto and treated him and he's better.
Wow.
Not wild.
Yeah, I don't think I've ever heard of a person that had lepto before. I've seen it a couple times in dogs, obviously, but
yeah,
people in lepto, it sounds scary.
On one of my veterinary boards online, there's a veterinarian who is hospitalized with lepto. Got it from a patient.
Really? From their dog? Or
A
dog
patient, yeah.
Oh, interesting. Well, we are going to jump into some viewer questions. As always, I do want to remind everyone the content of this show is not to be used as medical advice. And please never start, stop, or change your dog's treatment regimen without talking to your family veterinarian first. All right, the first question is, why is telehealth not used as much in veterinary medicine as it is in people?
Ooh, so this is a hot topic right
It is.
now.
I want to rephrase it actually and say, why does telehealth not work in veterinary medicine?
Yeah.
It's not a topic of why isn't it used. It just doesn't work.
It shouldn't be used. Yeah. So animals can't say what's wrong. So a lot of times owners will bring in their pet and just say, hey, they're vomiting or hey, they're not feeling well. And we have to figure out what it is. And the most important thing that we can do is a physical exam. Even more so than blood work or x-rays, the physical exam can tell you so much about a patient. And when it's telemedicine, you just don't have that. And you can't say to an owner, like, palpate their abdomen. Can you feel their lymph nodes?
Right.
Check their gum color.
Yeah.
Is it normal? And they're like, what's normal?
What's the time of their mucous membranes?
Yeah.
What's their CRT?
Yeah, like
capillary
check
refill
those.
time.
Feeling pulses. Like there's just so much. And to a normal owner, a lot of times they don't even realize what we're doing when we do an exam.
Mhm.
They think we're petting the pet. And I've had some people say like, well, are you going to do an exam? And I was like,
Sorry, I'm just giving your dog a little belly
I
massage
just
first.
did, but it comes so natural to us, but it's so important to do a physical exam.
Mhm.
Even skin stuff, like people are like, oh, look, it's a rash. And it's like, well, I got to get up close and personal. And is it a
Mhm.
papule or a pustule or a collarette? Is it not even a rash and it's petechia, which is a blood problem,
Right.
like a
Is it
bleeding
in one
disorder.
place or is it everywhere? Is it
Yeah.
fleas? Is it ringworm?
Yeah, it's so important. And there was even a story that I heard from another vet who said her mom's cat was sick and she was on the phone with her mom back and forth all weekend about this sick cat. And they were, talking in detail. And this is her own mother she's talking to. And she's like, well, if you're not feeling better, I'll stop by on Sunday night, on my way home, whatever. So all weekend they were talking. The vet walked in the house and within 2 seconds of touching the cat, she knew what the problem was. And it was a urinary blockage.
Oh.
And she said, if I can't even communicate with my own mother what signs she's seeing at home, and it wasn't the typical signs of in and out of the litter box, like the
Right.
cat was just lethargic and not eating and not moving around much. And
Which is almost worse because you're at a worser point in the urinary blockage because
it's
you
not the
probably have
beginning
kidney issues.
phases.
Yeah, there's a lot of later effects that have probably taken
Yeah.
place.
So, if you can't even communicate with your own mom about what's wrong with the
Mhm.
pet, and within seconds, she knew.
Mhm.
She touched the pet, grabbed the belly, and she knew exactly what was wrong.
And it's nothing against owners. They don't
No,
have the
not at
medical
all.
training to make
Right.
those kinds of assessments and feel those things that we can feel in 2 seconds.
Yeah.
We can feel a bladder and instantly know. We just know it's that grapefruit feeling of it's
Right.
too big.
And it's because I've palpated
Mhm.
70,000 bladders in my life.
You probably did 7 today.
Yeah.
Yeah, I definitely think the physical exam is like you said, the biggest thing. We need a full physical exam when there's a sick pet, even a healthy pet. I think we pick up on things on a healthy pet just as much as we pick up on other things for a sick pet.
I had a patient come in today for a healthy visit. The dog wasn't having any issues. And during the exam, I found 2 huge lymph nodes. And they were lymph nodes they're like hidden inside the shoulder. And so this owner knows everything about her dog. She brought her in because there was a 5 millimeter bump on her ankle. And she wanted me to check that out. But during the physical exam, I found kind of hidden in the muscle and right inside the shoulder. So it's not easy to find a huge lymph node. So we aspirated it and we're sending it out and it's probably lymphoma. And,
Mhm.
And so this is a healthy pet. And this is the other thing that people miss out on when they go to like shot clinics. You go to a shot clinic,
Yeah.
you have a vet just take the temperature, give your dog a rabies vaccine and you leave.
Mhm.
They're not doing these physical exams that will find potentially life-threatening things.
Right. And in shot clinics, they're just conveyor belt style, in, out, shot. All right,
Right.
go. Pay
Yeah.
your $15 and leave.
So there's a reason you go to your vet that you've established a relationship with who can do a full physical exam,
Mhm.
Even if your pet seems healthy.
Yeah. And there's also that dynamic of when you have a relationship with a patient that you know very well, you can almost pick up that they're not feeling well because they're not acting like themselves.
Right.
So
Yeah.
you know your patients. And if you can distinctly see, okay, I can see that they're lethargic or their skin looks different than it did last time, you have almost an edge
Right.
to say, okay, I know this is wrong.
Mhm.
But someone on the phone or on, a chat website is not going to be able to tell that.
Right.
They
Yeah,
don't know the
exactly.
pet.
I walked into one of my boxer patient rooms and he always carries his little backpack in his mouth. And for the first time since I've known him, he wasn't carrying a backpack in his mouth. And I was like, what is wrong with him? And turns out he was really sick,
Aw.
but what telemedicine person would know that he's not carrying his backpack around in
Right.
his mouth?
Right,
You
right.
know?
And owners are great with relaying information about what's going on with their pets, but you have to rely on that information to make an assessment right away. So if you don't have the pet in front of you and you're just relying on this information that a person is giving you about their
Mhm.
pet, it could mean 10,000 things.
Yeah. Well, and even yesterday we had a cat come in. The owner just got back from out of town and they're like, he's just quieter than normal. And so just the visual exam, we were looking at the cat and we're like, he's breathing a little harder than normal. Oh, and he had been coughing a little bit too. So he came in because he was coughing and quiet. And we took a chest x-ray and he had fluid compressing his lungs. And they pulled like a cup of fluid out of his chest.
Wow.
And so, that's something at telemedicine, even if they can visualize the cat, you're not close enough to see like the abdomen is going a little harder than normal. And those are really subtle changes
Mhm.
that I wouldn't expect an owner to pick up on.
Yeah, yeah. That's what you're there for because you're the expert.
Right.
Well, yeah, I think that definitely comprehensively answers why we don't prefer telehealth in the
Yeah.
veterinary world. Come in, have your exam done. It will be the best quality of medicine for your pet. One thing I have learned from having a more admin internal role with my work and doing this podcast even is there's an AI feature or an app for almost everything.
Yep.
But you know what you can AI? Medical care and nursing skills.
Right.
All right. The next question is, what is one case that heavily impacted you as a veterinary professional? So the case that I think of first, and I have owner permission to talk about, is a case from the ER a long time ago. It was a 2-year-old golden retriever named Enzo, and he was the sweetest boy. Just everything that's fantastic about golden retrievers was this dog. He came in the middle of the night, and he was having grand mal seizures. Never had a seizure before. For those of you who are listening who are not in the vet world, a grand mal seizure is a little bit different than a normal seizure or twitching because it's very intense, it's very aggressive, it can last a lot longer. They have a lot more intense movements. They almost always lose control of their bowels and urinate. And it does need immediate emergency care because once they start, they almost, the neurologist actually taught me this as a good way to explain. It's almost like when you have a marching band that starts up, how one person starts to play an instrument and then the next person wants to join in and then the next person wants to join in. He compared that to having seizures is once someone starts playing music, the rest want to join in and it keeps up.
Oh, that's interesting.
Yeah, I thought that was an interesting analysis, which is very similar to what happened with Enzo. He came in, he started having grand mal seizures and he couldn't stop. Every few minutes he was having these intense seizures. And like I said, he had never had one before. So the owners, who are the sweetest people ever, brought him in. We stabilized him. We had him on anti-seizure medicine all night. We had him on fluids to keep him hydrated and keep his electrolytes balanced. And then he was transferred to a neurologist. They found a benign tumor in his frontal lobe.
Wow.
And he was put right to surgery. They did the brain surgery to remove the tumor. It was successful. They did radiation afterwards so that any remainder was taken care of. It was benign, but they wanted to be cautious and make sure that all the tumor was collected. And he did great after the surgery. He lived a very high quality life. He was on seizure meds for the rest of his life anyways, just as a precaution. But to my knowledge, he didn't have any more seizure issues after that.
Wow, that's incredible.
And I love this family. They're a golden retriever family. They love their Goldens. I babysat them a couple times over the years. Enzo ended up passing away. I think he was about 12 or 13. So he had
which is
10
good for
good
golden.
years.
Yeah.
But he did eventually develop a carcinoma around his eye. So he had an actual cancer that formed. He almost had it looked like they called it like his Norwal horn. Where he had a little, the tumor was growing
out.
Yeah.
Aww.
But he was just the sweetest boy. He joined me for my graduation photos when I graduated my undergrad.
Cute.
So he was in my photos with me. He had his little gray patch on his head from his radiation.
Wow.
So his owners are great. I still keep up with them, and we talk about how sweet Enzo was and what a great dog he was. I really should have them on one day because
Oh my gosh, yes.
they have a lot of golden retrievers. One of their Goldens was actually in a cancer study with University of Florida, I believe. And they had plenty of Goldens over the years that had cancer and they want to be part of that research study. So they had a golden retriever who participated, and I would love to hear.
Oh yeah, talk about that experience.
Yeah. And just having golden retrievers, it's so sad that golden retrievers statistically get cancer a lot.
Yeah, there was always a bad joke on our oncology rotation, which is cancer rotation in vet school, that the students always loved that rotation because it was boxers and golden retrievers. And those are just great dogs. So like all of your 90% of your patients was a boxer or golden retriever, but they all get cancer.
Isn't that always how it is too? It's good clients that get bad diagnosis.
Yeah.
And, these great clients who will go above and beyond. That's one thing that just breaks my heart is when you have a good client who will do anything and everything for their pet and they still lose them to whatever they get diagnosed with.
Yeah.
That's
and I mean,
that's
a limitation of medicine, even in human medicine.
But yeah, I think about Enzo a lot.
Aww.
That was one of my
He
top
really
cases.
Impacted you.
It really impacted me. It made me very appreciative of, just how fragile life is, not only for older dogs, because I have such a passion for senior dogs, but younger dogs can have these crazy things pop up. And it's not something we take lightly.
Yeah.
So they were very proactive and quick, and they ultimately saved their dog's life because of their quick reaction.
Right.
So
That's great.
shout out to them. They were great clients, and we miss Enzo.
Hmm. So the case I'm thinking of that impacted me in kind of a couple different ways. It was an older Saint Bernard, which you don't see a lot of those.
No.
Yeah. But I think she was about 10. And the owner called in and said, she's peeing blood. Can she get some antibiotics? And I was a new grad at this time. And I was like, we should really check a urine sample. And she pushed back. She was like, no, I know what a UTI is. She's peeing blood. She's peeing frequently. Can I just get antibiotics? And I was like, no, we really need to check a urine sample. Like there are reasons we do testing for this kind of thing. So she dropped off the urine, and the blood that was in the urine wasn't blood, but it was a breakdown of the red blood cells. So she didn't have any actual red blood cells in her urine. She just had that breakdown of it. So it made the urine brownish. No white blood cells, no bacteria, just this weird, like brownish urine. And I was like, well, this is not normal and this is not a UTI. So I requested her to come in with the dog, and we ran blood work. And the dog was anemic, had very little platelets. And on the physical exam, its belly was a little swollen. So then we went to x-rays and found a really big spleen in the dog. And so this dog had a splenic tumor that was breaking down the red blood cells and causing them to pee out this brown color because it's a breakdown of the blood. So in the morning, it was, my dog has a UTI. Can I just get some antibiotics? And in the afternoon, it was emergency surgery to remove a bleeding spleen.
Wow.
So that was, especially as a newer grad, just a good example of why we do things a certain way. And since then, I've had clients that act very similar. Why do I need to do this? Can't I just have this? And they become demanding. This lady was nice. She wasn't that demanding, but they really push back. And I think about this case because I saved that dog's life by not going, fine, give her antibiotics. Because if I did that, the dog would have been dead within a couple of days.
Right.
And then also, the owner could have come back at me. Well, you gave antibiotics and now my dog's dead.
Right.
And so she could have, somehow blamed me. The other thing I think about this case a lot is because about 6 weeks later, the dog ended up with lymphoma and died. And the spleen was actually a benign tumor. So I got to
Really?
call her and tell her that the big bleeding tumor on the spleen was benign and that her dog's going to be fine.
Which is rare that splenic masses are benign.
Yeah.
A small chance.
Oh, I forget the statistics off the top of my head, but I think it might
I think
be
it's single digits percentage-wise that are.
I think it's different. We should look this up.
We should. Let's look it up real quick.
Let's look it up. Okay. My guess is going to be 50-50. I think, no, the third.
It can't be 50-50.
It's not 50-50. A third.
What percentage of splenic masses in dogs are benign? 47.
Oh, okay.
Oh, you were right.
It's about 50-50.
Okay, so it's about 50. Okay.
There's something about thirds rule. A third is something and then a third.
Well, hemangiosarcoma, hemangioma. What's the third
Arrow
one?
had a fucking, sorry, we probably, sarcoma, which is super rare. Okay, anyway.
Sarcoma spleen?
Yeah, that's why he died.
Oh,
A sarcoma on his spleen. And then it met everywhere.
Oh, so it met even with the splenectomy. It was already met.
Yeah.
Oh,
Well, it
okay.
met later. Okay.
Anyways, back
to
spleens. So you called her, told her that it was benign.
Yeah, so
she was all happy.
Yep, I got to tell her dog's gonna live. The tumor was benign, so we didn't have to worry about chemo or it metastasizing anywhere. And then it was like 6 weeks later she came in. She's like, something's not right, and the dog had huge lymph nodes everywhere. And we started a steroid, and within I think another 6 weeks or so, the dog passed away.
Oh,
and it
completely unrelated issue.
Completely unrelated to the spleen. Absolutely unrelated. And it just goes to show you can do everything right. You can, but the body still does crazy body things and nature still takes its course. And but I do think about that dog a lot.
It's funny. We have kind of opposite but same cases. We think about, you had a case with a great client that didn't go well, but it was a great learning experience for you as a new grad. I had a similar experience. I was younger. I was still in school, and it was a case that I'd never seen before. And it impacted me just how heavily, being so on it is.
Right.
And
right. Yeah.
Same with your client.
With it,
yeah. She was very quick to say something is wrong, and you were quick to say something is wrong.
Right. And that day we were in surgery.
Yeah, that's great. So many cases I feel like influence us every day, but those are good ones.
Yeah.